Good afternoon, and thank you for joining us today as we talk about the pandemic here in Erie County. I'm joined by several guests today as we'd like to focus on our back-to-school efforts amidst a global pandemic. We're hopeful for a return to school this year, which looks as normal as possible. We know it's so important for the education and the social well-being of our children. And in order for this to happen, it's essential that everyone, as much as we can, stays healthy. Today, we have 31 new cases to report of COVID-19 in Erie County. According to the CDC, Erie County is currently in substantial spread of COVID-19. But it's important to note that we are very, very close to a high rate of transmission, and we will likely move into that range by tomorrow. This uptick in cases is truly concerning. Along with the increase in cases, we've seen an increase in hospitalizations and, sadly, an increase in death, with 2 additional deaths to report today in Erie County. It's especially important as we head into fall that we do everything we can to protect ourselves, our neighbors, and our loved ones. And we have 2 tools in which we can do that. The first being vaccine, and the second being a mask. The CDC recommendations for communities in substantial or high spread, of which we know we're in, is universal masking indoors. This means everyone, regardless of vaccination status, should wear a mask which covers your nose and your mouth when you're inside with people who do not live as part of your household. As a reminder, the CDC has always recommended that unvaccinated people wear masks regardless of the community rate of transmission. It's also vital that everyone who is eligible gets vaccinated. Vaccines are safe, and they truly work to keep us safe from the severe effects of COVID-19. Vaccinations are now available for every person 12 and older. They are free for everyone. No health insurance is required. And they are readily available. Up-to-date information about vaccination sites can be found very easily at vaccines.gov, or you can go to eriecountypa.gov to find more information. There is an upcoming mobile vaccination clinic tonight at the Lake Erie Community Park in Lake City from 5 to 7. You can go out, you can enjoy some music, and you can get your vaccine. And there's also a clinic scheduled this Saturday from 9 to 1 at the Northwestern Food Pantry in Albion. I'd like to thank the Department of Health. They've continued to work very hard to bring information, education, and accessibility of testing and vaccine to members of our community with the mobile unit. However, there's only so much that our health department workers can do. People have to come out and take the vaccine. Currently, less than 54% of the eligible Erie County residents are fully vaccinated, and only about 48% of our total population, because remember, children under 12 can't get vaccinated, are fully vaccinated. So again, many, many people in this community not vaccinated. The increase in vaccination rates has been slow-paced, and without more people vaccinated, we are going to continue to see numbers rise, and we will likely see a spike in cases as our activities move indoors as fall and cold weather comes upon us. One of our biggest considerations with fall is the return to school. So many of our school-aged children are not eligible to be vaccinated. And while masks will keep them safer, they are not afforded that double layer of protection, a mask and a vaccine. So it's up to the rest of us who are eligible to get vaccinated to do that in order to protect our children in our community. Our shared goal this school year is in-person learning. I think we know from watching communities that have already started school that our best chance at uninterrupted in-person learning is to provide as much protection as we can by masking and having all eligible people vaccinated. Today we have with us two physicians, and now I'd like to turn it over to Dr. Svetlana Shurash, a pediatrician with UPMC Health Network. She will provide information about masks and vaccines for children. Dr. Shurash?
Hello, everyone. I would like to go over interim guidance from American Academy of Pediatrics today regarding safety plan. American Academy of Pediatrics advocated all policy considerations for back-to-school plans should start with the goal of keeping students safe and physically present in school. The remote learning focused our attention on inequalities in education, created multiple challenges for teachers, students, and their families. Pediatricians saw an increased number of mental health problems and as well obesity between children and young adults. The benefits of in-person learning outweigh the risks when proper mitigation strategies are used. We are privileged to have available, effective, and safe vaccines for those who are 12 years and older. AAP urges all eligible individuals to receive the COVID-19 vaccine. This is a very important step which will help our children to stay at school safely. And American Academy of Pediatrics recommend that all students older than 2 years of age and all staff wear a face mask at school. And there are several reasons to support universal maskings, and one of them being a lack of approved vaccine for the students. We should encourage masking to protect unvaccinated children from COVID-19. Pediatricians currently have major concerns about a new variant, Delta, which is more easily spread among children. Kids who have had or have been exposed to COVID may later develop a serious and potentially deadly condition, which we call multi-system inflammatory syndrome in children. This condition can cause inflammation of different parts of the body, brain, heart, lungs, eyes, skin, kidneys, and gastrointestinal organs. It may appear weeks after infection, even in those who didn't show symptoms. Children's Hospital at the southern states are seeing more children of all ages hospitalized with COVID-19 than ever before. And some require specialized critical care and pediatric intensive care unit. Some of those units are running out of the beds. In addition to decrease in transmission of COVID-19, universal masking will alter the transmission of other respiratory infections, such as RSV and the flu. Universal masking and social distancing altered transmission of RSV previous year. However, this season we've seen unusual RSV activities. Just only over the last months, we already saw 2 cases of RSV bronchiolitis in our community, which is very rare, which is very early. We usually see this activity starts around fall and winter. As a parent and pediatrician myself, I know parenting is not easy, and we constantly have to make decisions for those who cannot make them. However, to keep our children safely engaged in school, we have available tools, universal masking and vaccination. Thank you very much for your attention.
Thank you, Dr. Shurash. And now I would like to have Dr. Ravi Chekka, who is also with us today, a pediatrician with St. Vincent's Health Network, to speak a little bit further about children and COVID-19. Dr. Chekka?
Hello, good afternoon, and thank you for letting me discuss some of these issues with everybody too. So a lot of the things I'm going to talk about kind of tie into what Dr. Shurash had mentioned previously. So sometimes we get into a lull where we believe our children are safe based on original data from years ago, over a year ago, with low transmission rates or low infectivity rates and low hospitalization rates. That doesn't necessarily seem to be true at this day and age. So with this current variant, we see increased hospitalization rates and increased significant illness in some of these children. One of the most concerning things to note is that several hospital systems in the southern states have run out of pediatric ICU beds. And that is a concern. Some problems with that is not necessarily with this infection, but with co-infections, with things that we don't normally see at this point in time, including RSV, parainfluenza, rhinovirus, things that just are somewhat unusual, these viral illnesses, but are really, really making surges at this point. So we're not seeing just coronavirus, we're seeing 5, 6, 7, typically seasonal viruses that are surging in all of these places, including Erie, Pennsylvania. And that kind of will put a strain with staffing, with situations where we're not necessarily equipped to handle this type of patient population. So we have really easy, fairly simple mitigation measures and that are fairly effective. Unfortunately, children under the age of 12 cannot get the vaccination routinely at this point, but we do expect to see changes in that in the near future. Again, I can't guarantee any timeline, but the information that we receive on updates seems like sometime in the near future we should have an update on vaccines for younger populations. Again, I thank you for listening to me and letting me describe my concerns and giving my opinion on some of these simple mitigation efforts.
Thank you so much, Dr. Cheka. And, you know, as a grandmother, and I've noticed my own grandchildren last year when they were all wearing masks, most of the time when they were out, they didn't have any colds, they didn't have flu, they didn't have so many other symptoms. And so we know that masks not only protect against COVID-19, but against so many of these other medical issues that both of our physicians have spoke to today and are very concerning, because some of these diseases can actually really affect children so much that they have to be hospitalized. So as we focus on the return to school, I'd like to introduce our next guest, Mr. Brad Whitman. He is the Executive Director of the IU5, which is our support unit for our schools in this region. Brad?
Thank you, Kathy. I know many of you are wondering what the school year is going to look like. What I do know is that our school districts have two goals: students in school and as safely as possible. They're trying to balance not only the health recommendations, but the impact of masking requirements and other mitigation strategies on educational and social emotional needs of their students. It's not easy to balance public health with the needs of many different communities. For information on what your school district's plans are, you can visit your school district's website and locate the health and safety plan that is required by the Pennsylvania Department of Education to be posted there. Within that plan, you will see your district's guidelines that they will be following for the upcoming school year. It's important to note that your local school districts continue to work closely with the Erie County Department of Health, the PA Department of Health, the PA Department of Education, and the Northwest Tri-County Intermediate Unit as we continue to navigate these unprecedented times. So for that fact, I'm here representing all the superintendents in Erie County with that message, and encouraging all of you to visit their websites to see their board-approved health and safety plans as to how each and every school district will return to school this year. Thank you, Kathy.
Thank you so much, Brad, and thank you and all the superintendents and truly all the administration and staff of our schools in Erie County who continue to do a phenomenal job educating our students, especially during a global pandemic. Extremely challenging, and we all thank you for your work. And now we'd like to turn it over to Melissa Lyon, our Director of the Department of Public Health, who you all know very well by now. Melissa.
Thank you, County Executive, and it's always a pleasure to be with you as well as our guests today for this back to school kickoff informational session. I think it's really important that we're demonstrating the level of communication that we're having with the physician experts around pediatrics and school-age children, as well as the leadership at our school districts. you can be assured that we are communicating on a regular basis about the importance of getting students back into in-person learning, where we know that that is best for children's learning, families, and how they navigate this. And I can tell you, as a mother and a grandmother, I understand everyone's frustrations. And I really do feel as a community that the restrictions of the pandemic is imposing on all of us has been very challenging. And it has caused a lot of frustrations. But I want you to know that we have been taking a lot of steps to balance what public health measures are appropriate to keep us safe and doing the things that we know that we need to be doing as a thriving community. And so you've heard about some of those today, and in particular, the universal masking for children in K through 12, as well as the opportunity to get vaccinated if you are within the eligible population. I won't reiterate the importance of that. I just want everyone to know that those are the most important pieces that we have right now. In addition, you've heard some of our guests speaking about the Delta variant, and here in Erie County, we actually have a formal report that Delta variant was in our county on July 14th. That was when the sample was collected. It was ran for sequencing and reported to us on August 13th. So we've had Delta variant in our communities since middle of July, if not earlier. In addition, I want to talk quickly about the idea that quarantine and isolation was not part of the governor's mandates or not part of the just COVID-19 pandemic. Isolation and quarantine are traditional public health strategies powered to the Department of Health through what we call public health law to prevent infectious disease and communicable disease spread. We use this for tuberculosis. We use contact tracing for sexually transmitted infections. We use this for other types of communicable and infectious diseases. So it's very important that everyone understand that when you're being asked to either isolate if you're positive or quarantine if you're a close contact, that is still our authority to prevent the spread of infectious diseases in our community. So you're asked to please follow these instructions from our contact tracers and disease investigators. As well, we put together a flow chart to help the school districts determine what close contacts would look like for students. And if we have universal masking in those schools and students are 3 feet apart or further, we will have less interruptions within the school district because you will see less students being required to quarantine because they will not have been considered an exposure if all students are masked and separated by 3 feet distance. So we're working very closely with the school districts as they've been putting together their safety plans that Mr. Whitman had presented to you to go visit at their websites today. So with that, I will stop and hand it back over to the county executive, and thank you for your time.
Thank you so much, Director Line, and a huge thank you to your staff and everyone at the health department who's continued to work diligently for 18 months or more now on this global pandemic. I don't think there's anyone who feels more strongly about the safe return to school for students than the parents of those school-age students. So our final guest today is Yarimar Cosme, who is a mother of 2 local students, and she's here today to share her experience with COVID-19. Yarimar, please speak.
Hi, everyone. My name is Yarimar Cosme, and I'm a mother of 2 children, 14 and 15. And I encourage you as a parent to get your son vaccinated. I support in-person learning. My son is a kid with learning disabilities. That in-person learning is the best for him. And to take care of kids and put it up there in the school so they do better. I encourage you guys to take care of yourself and get vaccinated so they be in good health, and trust the people who know about that, the doctors and everybody who's talking to get vaccinated. They know what they're doing. So I encourage you guys to do it for your health and for your kids' health and safety. Thank you so much.
Thank you, Yarimar, for being with us and putting out that plea to parents to please think about the children and their safety as you think about whether to get a vaccine. So we're very thankful for everyone here joining us today to tell their story. We really want to prevent other families from having to experience any kind of ordeal with COVID-19. As a mother myself, as a grandmother to children too young to be vaccinated, I ask all of you to please consider those young people, all of our loved ones, and what you can do as a community member to keep them safe. Get vaccinated, wear a mask when you're indoors with others who are not part of your household. And now I'd like to turn it over to the media for questions. And we'll start today with Erie Times News.
Hi, Kathy, it's David. Thank you. Got a question for Brad. Brad, I know the school boards right now are in the process of voting on the mitigation factors, whether there's face masking, if there's only going to be face masking during high or significant community transmission. Do you know of any public school districts in the county or private school systems that have chosen at this point to make face masking voluntary for the school year?
Brad?
Thank you. We have a wide variety of back to school plans that are on the table and that boards are voting on right now. And those plans do range from being optional, parent permission, with highly recommended masking to masking universally right out of the gate, and some districts that are looking at the different levels and local data to make those decisions. So yes, we have school districts that have it optional all the way to starting the school year universally masking at this point in time.
Brad, we don't know of any school district right now that has approved a voluntary masking policy. Do you know of one that it's been approved? It's already been voted on? And if so, could you tell me what district or school system that is?
If you reach out to me offline, I probably can get that for you. I do not have that information right in front of me right now. As boards are voting as early as last night, and some boards meeting tonight and tomorrow night. So I'm collecting all of that data, but I do not have it right at my fingertips now.
All right, thank you.
Thank you. Erie News Now.
Hi, good afternoon. A question for Dr. Cheka. Doctor, if you were advising a school board, would you recommend universal masking for students regardless of age or vaccination status?
Dr. Cheka?
Are you able to hear me? Okay, good. Thanks for the question. So, we get down to some semblance of mitigation methods that are simple and somewhat that do not have negative detrimental effects, right? So things like masking is fairly easy and relatively non-detrimental, right? And it can cause a significant decrease in viral illnesses. And let's not talk just considering the coronavirus. So it decreases the transmission of many viruses. So influenza rates were profoundly low. RSV rates were. So with that in mind, I think it's a great idea. I think recommendations are really, really important. Now, if we were discussing it from the perspective of the board, right? That's my perspective. There's lots of other things that go into place. And I really, really think it's important to understand that if you only create a recommendation, and we've all been teenagers at some point, there will be places or groups that have ostracized these students that potentially make a decision that would make them somewhat different from others. So what does that mean? So if, let's say 30% of the students think it's a good idea on the first day of school to wear masks, because it is a good idea, right? What could happen to those 30% if there is potentially bullying or different things that could occur that could cause those 30% to not wear their mask afterwards for various reasons. So then the recommendation of a mask is not, or a voluntary mask mandate, right, is not necessarily as important as a true mandate, if that makes sense. So I do think it's a good idea. I would definitely support it. And again, it's fairly simple, right? It's just putting a piece of mask, properly used, it can be effective. much of the data that shows that masking is not that effective is typically when it's not used properly. So when they become saturated, you have to have an alternative mask. You have to have 2-3 masks with you. Let's say your mask is on your chin. It doesn't typically work, right? So there's a lot of things that can be re-educated or kind of focused on in order to make those measures more effective. I hope that answers your question.
Let me ask this more bluntly. As a medical professional, as a pediatrician, from a medical perspective, would school boards be wise to mandate mask wear?
Based on everything we know, yes.
Thanks.
Thank you. Jet TV.
Hi, it's Chelsea. The vaccines have been available for a while now, and many people still aren't vaccinated. Are there initiatives coming from the county to educate people about the vaccine or to receive it, or possibly even some form of an incentive offered to Erie County residents?
So I'm going to let Melissa Lyon talk about all the different efforts undertaken to try to encourage vaccine.
Thank you, County Executive, and thank you for the question. So we are finding that the uptake of vaccines is very slow. It's also being reported from health systems that they as well are having maybe double digits, low double digits of individuals becoming vaccinated. However, the bright light here, the silver lining, is that we're taking time and we're communicating and educating. And so anyone that has questions, we're spending a lot of time, and we're not pressuring them to get a vaccine at that moment, but giving them information that they can then process and then use as they're making an informed decision whether they're going to choose to get a vaccine or not. We're going to continue those efforts. It's not going to change. We have a mobile unit that travels throughout the county. You can find our schedule on our county website. And we are out almost 5 days a week doing either testing or vaccinations. So that's the efforts that are happening, and they have been rewarding. We knew that it was going to require a lot of conversation. You're not going to see likely a lot of media from us saying that you need to get this vaccination. What media at this point in time is probably not as effective as actually one-on-one conversations, giving someone time, actually asking them their concerns and having empathy with their concerns and really understanding, not dismissing what they're concerned about. We're walking them through either the science, helping them understand what happened to someone or why that may have happened, would it or would it not happen to them. A lot of different scenarios, and that's incredibly rewarding. So that's where we are in our efforts, and we'll continue to do so. Thank you.
Thanks.
Thank you. And now we'll go to Talk Erie.
Yes, thank you, County Executive. It's Joel Natale. I have a question for the healthcare pediatricians. Out of the recent hospitalizations, there's 29 today, according to the state. How many of the hospitalizations in the last maybe 3 or 4 weeks have been of school-age children?
Either one of the physicians who'd like to take that?
Yes, I can answer regarding the hospitalization for children in UPMC Health Network. We have not seen any children hospitalized for COVID-19 yet, but as I mentioned earlier, we already has discharged at least 2 patients with RSV bronchiolitis. Thank you for this question.
And Dr. Cheka, would you like to speak from AHN?
I will again hash that same point that Dr. Sarash made. None that would be hospitalized at say AHN St. Vincent's Hospital with COVID-19 as of this point. But again, same point. Several admissions and discharges with various other viral illnesses, including RSV, parainfluenza, rhinovirus, and within the last couple of weeks. So it's not something profoundly rare, and it seems like it's worsening. So thanks.
If I could have a quick follow-up, Dr. Cheka, I'll start with you. You know, with the Delta variant so contagious, doesn't it matter what kind of mask the kids wear? I'm hearing from national epidemiologists that they need a KN95 for it to be really blocking the virus.
Yeah, so that's the ideal, would be having KN95s or N95s, but it's I don't know if that's realistic to be able to accommodate. So the mitigation efforts just mitigate. It doesn't eliminate the risk, right? So if we have surgical masks, that decreases the risk significantly. If we have KN95s, it really decreases the risk significantly. N95s profoundly decrease the risk, but some things have to be utilized within reason and ability. So yes, your point, absolutely KN95s would be more ideal, but I don't know if it would be profoundly realistic. Hopefully that answers your question.
Thank you.
Thank you, Joel. We'll go back to David at the Erie Times News.
Thanks, Kathy. This question's for you. I know you often talk on these press conferences about going out and about the stores and seeing, the mask compliance for people back when we had a mask mandate. Now that it's strongly encouraged, it's not mandated, what kind of compliance do you see at the grocery stores? And give me your assessment about how people are doing the last couple of weeks with masks being strongly encouraged indoors but not mandated.
So what I'm seeing is more people are wearing masks, but still many people are not. As I've been in the grocery stores, as I've been in a number of different settings inside, I know myself, I'm wearing a mask when I'm inside. And I encourage everyone else to do that. And people have even asked me, and they said, would you like me to wear a mask? And I said, yes, I would, because it's really best if we're both wearing a mask. So that is the important piece, is that both people wearing masks gives you that protection. But yes, we need more people to start wearing their masks indoors again, pull out those masks that we all have in our drawer and bring them out and put them in your car, in your purse, in your pocket, and have them whenever you go into any indoor place.
And just to follow up with you, we had talked early last week about what might lead to a mask mandate, and you said basically if the state required it, or if COVID hospitalizations really increased. We've seen an increase, percentage-wise it's significant, still not a huge number of them countywide. Is that what you said early last week to me? Is that still pretty much your take on this for mandates?
We are monitoring with the hospitals. Melissa Lyon has a meeting with them every week, I believe now, and we are monitoring the bed availability. But I do want to put out a plea to people. Again, this is about vaccination and masking. Our healthcare workers were overwhelmed last winter. They did a phenomenal job at all of our hospitals locally, but they were exhausted. They hardly had time to go home and be with their own family. And the mental and the physical exhaustion that they experienced, we don't want to put them back there again. And we're seeing it in the South. And I said this last year, the South had more issues in the summer because it's so hot. I used to live in Houston. It is so hot you can't be outside in Texas and Florida and some of these states. So they're inside, and we're all going inside again in another month or so when the weather starts to turn and gets cold. So let's do what we can now to knock this virus down so we don't get our health systems overwhelmed. And again, I plead to people, for the sake of our healthcare workers, for the sake of our children, please go get a vaccination. Please wear your mask. Do both of those things. And I think we'll be in such a better place when fall truly comes. I'll go back to Ethan at Erie News Now.
Hi, a question for you, County Executive. In the last 3 weeks, according to state data, case totals have more than quadrupled. Hospitalizations in Erie County have nearly quintupled, an average of about 16 people in the hospital each day right now. Today, though, with 29. And as you plead for people to wear masks, as we hear expert after expert urge them, why not issue that mandate now?
So we are trying to follow the guidelines, of course, that the CDC has put out. It is difficult, to decide these things, because people have very different feelings on this, and businesses have very different feelings. But it's not about that, right? It's about trying to protect people as best we can. So we're hoping that we can get better compliance with this press conference, with getting the information out to people about how crucial it is. And if we can get better compliance from people voluntarily, if people decide, yes, I'm going to do this because I want to protect the children. We're talking about going back to school right now. That's really what our emphasis is today. That's what we need people to do. We need people to be responsible. We need people to be a good citizen. You know, there's been a comparison to wearing seatbelts or putting your child in the car seat. We don't wait until the accident level is so high to say, okay, now everybody put your kids in a car seat or everybody put a seatbelt on. We wear our seatbelts and we put our kids in car seats just in case we get in that accident. We will be much better protected and probably our lives will be saved. That's what we're doing here. We're asking people to do the right thing, to get a vaccine, to put on your mask, because you don't know when you're going to come in contact with that person with COVID-19, or you might be that person carrying COVID-19. So that's why we need everyone to be a good citizen and do the right thing. And so that's what we're trying to ask people to do here.
County Executive, to carry on your analogy there, seatbelts, car seats, those are mandated by law. With a mask here, is there any reason to believe that just urging people to wear them, do you really think we will see that jump in compliance without a mandate?
Well, I'm not sure, and we're going to see, and we're going to continue to monitor this. It's not off the table at all, and we need to see, you know, how things go in the next couple weeks. But you are right. We have gone from low transmission to, like we said, by tomorrow, I believe we'll be in high. We have done that in 4 weeks' time. That is a very fast progression. And we are seeing what's happening in the South. So we should learn from our neighbors to the South whose kids are already in school that we need to do something here. And we're asking people to make the right decision going forward.
Thanks so much.
We'll go back to Chelsea at Jet.
Hi. There are plans for a training concert to happen this weekend at Erie Insurance Arena, which is obviously indoors. Will, people have to show proof of vaccination or wear a mask? Is there any guidance for that upcoming concert that could be filled with lots of people indoors?
So it is an indoor event. Everyone, vaccinated or unvaccinated, should be wearing a mask.
Okay, thank you.
We'll go to Joel at Talk Erie.
Yes, thank you. I have a question for Mr. Whitman. Considering all of this talk about protecting the children, should school districts be requiring at this point now that all teachers and staff are vaccinated?
Thanks. Well, first off, they can't mandate because we do not, as you heard earlier, we do not have vaccines available for our younger 12 and under population. Pennsylvania is uniquely positioned that we are a local control state, which therefore provides the local control to each and every district. So that's where we are uniquely positioned, and that is why each of our district school boards are elected to make those decisions on behalf of their school and their community.
Again, just talking about teachers and staff, which would be the adults in the room, should this not be should there not be maybe incentives for teachers to be vaccinated, staff to be vaccinated? Even the union has come out to say that that they would consider a mandate even at a national level.
So if I hear your question correctly, you're asking if each school district should mandate?
On the staff level, on teachers and staff, yes.
Again, that every community is completely different. And I know that we're hearing talk of that across the country and in different associations. But again, right now that is just talk. And each of our districts are very unique. And again, that's why Pennsylvania has local control and allows those boards to make those decisions. So I can't speak for them.
Thank you.
Thank you, Joel. I will add one thing to that. In Erie County government, although it's difficult to mandate vaccine at this moment in time, we have put in a policy that we are only hiring people who are fully vaccinated at this point in time. So any new applicants must be fully vaccinated in order to get a job in Erie County government. Now I'm going to go back and ask David, do you have a final question from Erie Times News?
Yes, Kathy, I want to follow up about the train concert. You had said that everyone should be wearing a mask, but they are not required to have a mask to wear to the train concert, are they?
I don't believe they are at this point, but I will be making a call after this to Erie Events to find out, what kind of mitigation efforts they are looking at, because I do know that other venues, particularly in Allegheny County, have put in mandates that you have to be vaccinated or show a negative test to be able to get into a concert of that magnitude.
Well, and that leads to a bigger question. We're about ready to have a whole bunch of indoor events, ranging from indoor sporting events to other music to concerts, a whole bunch of things. In your opinion, are you going to be pushing to have that be vaccinated or masked for all these events that might be coming up in Erie County the next 6 or 8 months?
We'll be having we'll be definitely having conversations around that with all of our indoor venues. Again, it is the wise thing, the safe thing, the responsible thing to do. We have now required masking for anyone coming into county government, whether you work there or whether you're a visitor. City Hall has done the same thing. Some other businesses are making it optional. I actually encourage businesses to make it mandatory. You can do that in your own business, and businesses should seriously be thinking about that if they want to stay open going into the season, the colder season here. As we know, this Delta variant will spread even more as we go indoors.
All right, thank you.
Mm-hmm. And a last question from Ethan at Erie News Now.
Hi, a question for Dr. Sarash. As a medical professional, as you look at all of this, the way cases are trending in our area, is there any reason to believe that in the immediate future, anyway, the next handful of weeks, that this situation will improve?
Thank you for your question. I just would like to repeat your question, making sure I understood correctly. So you're asking about our prospection of cases in our community, is it right?
Yeah, in Erie County, as you see the way the data is trending, is there any reason to expect things to improve significantly in the next, say, 3 to 4 weeks?
I would agree with other speakers that we will be going to indoor season soon. The weather will get worse and students will go back to school. So we will spend more time indoors, and it obviously, as the usual results, we always see increase in respiratory infections between children, and we see increase of hospitalizations. I believe that universal masking will help to change the expected increased number of those hospitalizations. Thank you for your question.
Thank you, Doctor.
Thank you. And Chelsea at Jet TV, do you have a final question? Chelsea, are you with us still? Go to Joel Natale at Talk Erie.
Yes, one last question for Director Lyons. Melissa, just clarification, you had mentioned about quarantine and isolation. Now, the Secretary of Health here in Pennsylvania had said that vaccinated people, even in an exposure, did not need to isolate or quarantine. Has that guidance or mandate changed?
So Joel, thank you for that question, and it's a very important piece of information, because quarantine and isolation has the requirements have changed that based upon your vaccination rate or an exposure. And so that's why I was trying to say that it's really important that you pick up the phone and talk to our disease investigators and our contact tracers, because then they can walk through your particular scenario if you have been exposed to someone that was positive, and if you are vaccinated, then what's expected of you. And you are correct that quarantine is a lot. Basically, would be encouraged to mask and monitor your symptoms as of right now. So there's a number of scenarios, which is why I said there's a flow chart that we've created to help the school districts, because it's not as straightforward as it was prior to us having access to vaccines. Thank you.
Thank you.
Thank you, Joel. I want to thank all of our guests today. I think it's been a really good informational press conference today about back to school, children's safety, with two things highly emphasized. That's wear a mask and get vaccinated, those two things. But I want to end with some really good news. We have the Emergency Rental Assistance Program happening in Erie County. So far, we've had 2,039 households assisted with either being able to pay rent or utilities, and that rent payment goes to the landlord and the utility payment goes to the utilities, and that has been just over $10 million to date in Erie County, helping to continue to keep people in their homes, keep them from being homeless, and provide assistance to keep the lights on, etc. So Erie County, we're very proud of what they've done. It's Erie County Care Management is who's running this program. If you believe you're eligible and are having struggles with paying that utility bill or paying your rent throughout this pandemic, you can go to eccm.org and see if that assistance is something you're eligible for. So thank you to ECCM and the staff there for the great job they're doing. Honestly, we're doing one of the best counties in the state and maybe even in the nation in terms of getting that money out and getting it into the hands of the people who need it in our community. In the meantime, if you're feeling ill at all, please stay home, monitor your symptoms, go get tested for COVID-19, take the precautions versus going out and being around other people. Please, please wear your mask, vaccinated or unvaccinated, when you go inside any building, any indoor activity that you're doing. And if you have not gotten vaccinated yet, go to vaccine.gov, find the closest vaccination place for you, and it's free. People in Erie County love free things. It's free. You don't need health insurance. Please assist our community in staying healthy. Help our children have a good school year. Get vaccinated. In the meantime, stay safe. Thank you.
All right, we are clear. Thank you, everyone.